My name is Tim Long, the CEO and founder of New Life Medical Center, and today I'm going to talk to you about the red light therapy and a couple of questions we get asked most often. And hopefully, if you're following us on Facebook or even our website, newlifemedcenters.com, you will see that we're posting progress pictures as we go on. We just got the system in, and we're just getting started, but we're already, you'll see probably 10 or 15 pictures of people in the very first session. We have a couple people that we're actually agreed to allow us to follow them so we can do video testimonials and pictures, and you'll see those and you'll see that they're amazing results. But most people ask, does it really work? And I'm telling you, that was my doubt too in the beginning. I researched this over almost a year at this point before we decided on the system we started using. And again, I said this in other videos, but I've talked to scientists, engineers, doctors on all the coast of the United States. I talked to patients who used it. I talked to the doctor who helped develop the system we use. I talked to engineers, the manufacturers. I even talked to consultants that represent multiple products. In addition to all the research I did on PubMed and looking at the different things. So we wanted to make sure it actually did work, and does it really work? And even after I did all of that, until I got the system in and we started using it, I still didn't believe it until I saw it with my own eyes. So I was exactly where you are. It sounds like it's too good to be true, but I can tell you with this product, this technology, it isn't. And I covered in a video what to look for, but it is true, and it's so true we guarantee it. And I'll cover that in just a second. The other question we ask is it permanent? So let me kind of explain how the process works. Well, one, is it true? It is true. So we guarantee it. And as you follow our progress pictures, you'll see for yourself. But if you want to come in and try it, you can come in and try it for 50% off. It's just one session. You try it. There's no commitment whatsoever. And we don't have any salespeople here, so you don't have to worry about that either. But if you want to come in and try it for $59, if you don't lose at least 2 inches in the very first session, there's no charge. It's free. So we guarantee it because we stand behind it. We know it's going to work because we've seen it work firsthand. And no one else offers a guarantee like this, especially for fat loss. No one does that. We're the only ones. So how do we measure for that? What we're going to do is we're going to measure over one of your arms, just one. We're going to measure over one of your thighs, and we're going to measure over the abdomen. We're going to take 3 measurements on the arm, 3 on the thigh, and 3 on the abdomen. And between those measurements, you're going to lose a minimum of 2 inches, or you don't pay. And so far, we have not had to reimburse anyone. We've had people losing anywhere from roughly 2 and 2.5 inches, roughly, up to over 11 inches on the first session. That same person who lost 11 inches on the first session lost an additional 10 on his second. So he's lost 21 inches total. So, but everyone is different. Everyone's biochemically different. Not everybody's gonna get the same result. Everybody's gonna get a different result. So you don't know till you try it, but that's why we offer the money back guarantee for you to come in and try it. So if you don't lose at least 2, you're not gonna pay anything. But once we find out what you lose, we can then kind of adjust based on what your goals are, kind of what to expect going forward, how fast, how many treatments, that kind of thing. So does it really work? Yes, it does, and we stand behind it. And if it doesn't for you, you get your money back. All right, now, is it permanent? That was one of my questions too, because you all heard those little wraps that you'll wrap, and basically it's just water weight, and you'll lose maybe, I don't know, because I've never actually done it, but you'll lose a little bit of water weight for a little bit, but a few hours later, half a day later, it's all back. Well, this is nothing like that whatsoever, not even close. This weight loss is permanent. Now, it's permanent to the point where immediately you're going to lose the inches, and about a day later, and I'll explain here in a second, you'll actually see it on the scale. But just like with any type of weight loss that you've ever had in the past, if you eat more than you use in a day, that weight will come back. But with this process, our technology and our system, if you eat your maintenance level of calories, which means you're able to eat the number of calories you need to maintain your body weight where you currently are, you're not eating any more, so you're not having a surplus of calories that's going to be stored as fat. As long as you maintain that, the weight loss is permanent. So just like with any type of weight loss program, as long as you don't overeat, the weight loss is permanent. So this is kind of how it works. When we come in, you do a session. What happens is the red lights, and I'll talk about the wavelengths and all that stuff in another video. But basically, it penetrates the fat cells up to about a ½ inch under your skin. And what happens after about 15 minutes, those fat cells will then begin to deflate or release the fatty acids that are inside the cell. In about 20 minutes, it's completely released. And what happens is those fatty acids kind of spread around into the tissues right around that area. So you haven't lost any weight, but what's happened is you've drained those fat cells. Now the fat cells are still alive. It didn't kill the fat cells. They're still there. But it has drained the fatty acids out of them, and now it's in your tissue. So what we'll have you do after your 20-minute session is we'll either have you walk for 10 minutes or have you get on a vibration plate for 10 minutes. And what that does, it gets all the, everything flowing into your lymphatic system, which ends up being either the fatty acids or go through your lymphatic system and eventually to your liver, where they get expelled or they're used for energy. So immediately you're going to lose inches because it deflates those fat cells. It empties the fatty acids to the tissues, and we get it moving through the body. But you don't lose weight until your body's had a chance to process those fatty acids and then expel them, which typically takes, everybody's a little different, but roughly about a day. So also, after you do the vibration plate, we kind of get everything rolling, we do a measurement, and that's how we determine how many inches you lost. But as the day goes on, up to about 15 or 16 hours later, depending on your metabolism, you will continue to lose inches. And from what we've seen, and this is anecdotal, I haven't seen any of this in research, but what we have seen so far is you will lose about another 20% as far as inches over the next 15, 16 hours. So, because what happens is those fatty acids are released, but some of that's still in your tissue surrounding where we just measured. And it takes that long to kind of get it processed out of the tissues into the lymphatic system, into the liver, and so on. So for about the next 15, 16 hours, you're going to continue to lose inches. So, and we don't have you come back in and measure the second time to prove to you. It's just you'll know, because pants will feel a little bit looser, things aren't just as tight. You'll know. Now you can also measure yourself when you get home, and you can figure it out for yourself, but you will continue to lose fat for the next 15 to 16 hours as your body processes it. That's why you can only do one treatment every 48 hours, because after you do a treatment, you have to give your body time to process that fat and eliminate it. So is it permanent? Yes, because it's actually getting rid of the fat or the fatty acid. Now, can that weight come back? Yes, it can. If you overeat, you eat more calories than your body needs to survive based on the activity level you are having that day, that weight can come back. But it's only if you overeat. So if you don't overeat, that weight that you lost is permanent. So we have patients that cannot exercise and can't or don't diet, and you will continue to lose the weight. Like, for example, we had a patient, you can go on our Facebook, you can see it. It's Alicia L. She is a 36-year-old female who has CMT, which is a neurological disease where they have muscle wasting, especially in their calves are lower in their hands. So what she is doing to counteract that, because as you get older it gets a lot worse, is she's doing weight resistance. Now, she's trying to build more muscle to offset the loss, to try to keep from losing it. And that was actually prescribed to her by a doctor. And what she does is she works out, does weight resistance twice a week. She does no cardio, just weight resistance to help maintain that muscle. And in order for her to grow that muscle, she has to eat a surplus of calories. And in her case, she weighs 152 pounds. Based on her metabolic rate, in order to maintain that weight, not lose weight, not gain weight, she needs to eat 1,412 calories a day to maintain that. And what she's doing now is she's eating 2,400 calories a day in order to build that muscle, and it's higher protein because she wants to build the muscle to offset that disease. So right now she's eating 988 calories more than her basal metabolic rate, and she's mostly in protein, and she works out twice a week doing weight resistance, no cardio. And since she's been using the red light, at this point it's 4 sessions. It's been about almost 2 weeks. I think it's been 12 days total. She has lost 4 pounds while she's eating almost 1,000 calories more than she needs per day. She has lost almost 2 pant sizes, almost roughly about 1.5 pant sizes. But all of her jeans and all this stuff are loose now, and they're too big. but she's lost almost 2 pant sizes. And the last time we looked, and I don't have the measurement in front of me because we didn't start that at the beginning, which I wish we would have, but we didn't start it after she started. She's already lost almost 2% body fat. And that's only been basically in the last 2 treatments. So she's eating over 908 calories a day more than her metabolic rate calls for based on her weight. She works out twice a week, weight resistance, no cardio. And in 4 sessions, she has lost 4 pounds, a couple percent body fat roughly, and she's lost almost 2 pant sizes in 4 sessions over 12 days. So she's getting a session about every 3 days. Again, did you hear me? She's eating 1,000 calories a day more than she needs to maintain her body weight. So the reason I'm saying that is if you cannot work out, and we always, in a perfect world, we want you to do weight resistance, steady state cardio, not high intensity, but steady state, and watch your diet and do we don't believe in calorie restriction, but there's things you can do to increase your metabolic rate with your diet, and we cover it all in our weight loss program. But that's a perfect world. But if you don't want to diet, you don't want to restrict your calories, and you cannot exercise, as long as you're not overeating based on your energy output for the day, you will lose weight, and it will be permanent, and it'll be pretty significant. Now, again, I don't have any research on this. This is purely anecdotal, but we believe you can lose 30, 40, 50 pounds just using this product or this technology, as long as you don't overeat and you don't have to exercise or diet. So you can technically reach your goal without having to restrict calories, without exercise, as long as you don't overeat and you maintain your metabolic rate. So it's pretty amazing. And all we can say at this point is, yes, we know the fat loss is true. We also know that it's permanent. And the only way to prove it is for you to try it yourself. So we have a deal, we call it a try it session. It's half off. Our normal session is usually $120, but for the first session, you can come in for $59 and try it and see if you like it. And we guarantee if you don't lose at least 2 inches off of your abdomen and because we measure the arm, the thigh, and the abdomen. If you don't lose at least 2 inches, you don't pay, no charge. So there's no risk to you. We're doing that right now because we're just launching it to help get it out there so people see it. Because if you're like me, I thought it was too good to be true and it can't be permanent. But I'm telling you, it's not too good to be true. So come in and try it. We'll guarantee it. And it is permanent as long as you don't overeat over an extended period of time. Every once in a while, maybe no big deal. But overeat every day, yeah, it'll come back eventually. But if you don't, it's permanent. So if you have any questions about it, you want to try it, just give us a call at 901-213-0100 and give us, email us, contact the website, and we'll be glad to set it up, let you try it. And again, if you don't lose at least 2 inches, you don't pay. And no one else guarantees that. No other weight loss program guarantees that. We guarantee it. We know it works. We stand behind it. And we want you to come in and try it basically risk-free so you can see for yourself. And then you'll know that it works. Once you come in and try it, whatever your goals are, we can kind of, at that point, once you do your first loss and we kind of get an idea of how you lose, how your body reacts to it, then we can kind of give you an idea of how many sessions you may need. And we offer, you can do them one at a time, you can buy a package to save a little bit, or you can do a membership to save even more. And when you do the membership, there's less money up front, so you don't have to buy a package up front. It's lower, and the cost is actually a little bit lower too. And you just have to commit to a membership for at least 4 months. So just come in. If you have any questions, give us a call. We're always here for you.